Meanwhile, in the 1930s, under Franklin Roosevelt's presidency, that's when we start to see debates about some sort of national health insurance really emerge as something being considered. By this point, some groups within organized medicine, so medical societies, have started to say they don't like the idea of government enacting some sort of plan that would cover everyone. So by the time these things are being discussed at the national level by Roosevelt in the 1930s, the AMA starts a vigorous campaign against it. Roosevelt knows this, and for that reason he says, let's leave it out, because I want Social Security to pass, which of course it does. And after the war, Truman really follows through with this idea that Roosevelt had had. He picks up on Roosevelt's proposal for this economic Bill of Rights, which includes framing basic medical care as one of those rights to what he called the fair deal. Once again, the AMA in particular spearheads this campaign against the idea of national health insurance for many of the same reasons that they had been concerned about in the 1930s. They actually end up launching I think it was a $1.5 million lobbying effort against a proposal for national health insurance, which was at that time the most expensive lobbying effort in American history to date. And as part of this campaign, they frame this idea that Truman is proposing as socialized medicine and as something that is, again, foreign, essentially a foreign ideology that is creeping into American society and therefore must be resisted. And the other problem, too, is that you have a large segment of the population, so people who were working, who had health insurance through their employment, through one of these schemes that had started to develop in the 1930s, who maybe are basically satisfied with what they're getting. And that takes out a large part of the population that might otherwise be really arguing for and demanding a different kind of model. In 1943, there's a War Labor Board decision which basically excludes benefits from these very strict wage increase controls they had enacted during the war. In other words, they said, okay, if companies want to offer benefits like health insurance to their employees, that's fine. We're not going to restrict any sort of changes in that, even though we have these controls on wages. So that suddenly became a way for industry to actually become more competitive in a marketplace. So if they wanted to preserve a group of workers or if they wanted to attract workers to their company, they could offer more generous benefits, such as health insurance, to help attract and preserve the workforce that they were looking for.